Good morning, everyone. It is Friday, October 15th. Welcome into the Morning Medical Update. We are live inside the Dolph Simons Family Broadcast Studio. They have been on the front line since the very beginning of this pandemic, but it is really the kind of care that delivery that they give out every single day here at the health system and all over the place. So this week we have been celebrating them. It is Emergency Nurses Week from COVID-19
recliners and hall beds and being a lot more creative than we used to have to be.
From COVID-19 to those with broken bones and other injuries, these nurses are the ones who deal with all of that, and things certainly have not been easy as this pandemic continues. Dr. Steve Stites, of course, is right here with us today.
Good morning
to you. Good morning to you.
What's up? Live long and prosper.
We're going to talk to you in just a sec. Dr. Nathan Barr, though, is in for Dr. Hawkinson. How are you?
Good morning. I'm doing just fine.
Good to see you on this Friday with us. What can you tell us about our numbers?
So we have at the main KU Medical Center here in Kansas City 16 active cases of COVID. 7 of those patients are in the ICU and 5 of those are requiring a ventilator. We have a total of 49 cases, including those 33 folks that are recovering from COVID. In Hayes, there's a total of 19 cases, with 11 of those being active and 2 of those on the ventilator, and they did have a death, unfortunately, in the last 24 hours. Still some very, very sick people.
We're going to get to questions, Dr. Stites. So what do you make of the Hayes numbers versus our numbers? Why do they?
Yeah, you know, I think
people are concerned about how high they are.
Yeah, well, and should be, rightfully so, right? I mean, it's a question about vaccination status, I think, and public health measures. We've got a mask mandate in the area, and I think that's been really helping us a lot. I'm a little nervous about what happens when the masks come off. I think that it's going to be harder to get people to keep them on and harder to have political leaders want to keep them in place because our numbers are lower in the Kansas City area. Now, they're not gone, right? I mean, we got down to 5 at one point last March. But in fact, what they've done is they've come down, they've flattened. We had our chief medical officer call yesterday. And, they're still relatively high across the area. And but I think most people's are trending down or have flattened out a little bit, which is kind of where we are. We've been going between 14 and 16 acute infections every day now for the last week. Our transfer center's not still fully open. Otherwise, we would probably be a little bit higher. So I'd just be cautious about things. I'd say we are clearly better off. I don't think we were like we were last spring when things were really good. And I'm a little nervous about if and when masking comes off in early November, because a lot of the government-sponsored mask mandates are going to come off then, and if those come off, I think it's going to be tough for school districts to keep them on too. And I think that's going to make for some kind of a long, cold winter, and we'll see how that goes. But if people keep masks on and keep getting vaccinated, we'll do okay. I think the problem in Hayes is less vaccination and less mask mandates and not as good of preventive measures, and as a result, you're seeing more infection. And I think we can see that happen across the country. That would be the prediction.
Well, that's what you've said though from the beginning. Every time we see a change in the mandates, it shows up in the numbers. It's just simple.
It's just go ahead and read. Are we going to have another surge? Well, the question is, are we going to take off masks? Mm-hmm. When we take off the mask, we'll see another surge, unless we have a whole lot of people who have been vaccinated, or, in fairness, if a lot of people have had a recent COVID-19 infection with the Delta variant. I mean, you can sort of look at it as, and Nate can comment about this, if you've had a lot of folks with Delta variant, and you've had a lot of people with vaccination, you are going to have a little better immunity. It's going to be a short-lived immunity because you don't do as well in natural immunity as you'd probably do with vaccination, Nate.
Yeah. Even those folks with natural infection, it's pretty clear data now that vaccination after infection does provide you more long-lasting and more adaptive immunity. So if another variant comes down the road, which if we continue with big numbers around the world, we're definitely going to see that. So if you get a vaccine on top of a natural infection, you're more likely to be able to adapt and protect against that new variant than if you just remain without the vaccination.
Reporters on the line today?
Hey, good morning. Cody Holyoke with Channel 9.
Hey, Cody.
Hey, so we seem to be on the right track. The advisory panel seems to be very busy over the next week and a half, with a booster getting the green light to go to the FDA yesterday, another one today. Panel meets October 26th to talk about Pfizer in kids 5 to younger than 12. I'm curious your thoughts on this. Are the stars aligning in your eyes? What needs to happen, and how are preparations going behind the scenes?
The stars are going to align when people get vaccinated. That's when the stars align. But in the meantime, I would say that this is I think this is pretty good news. First off, let's talk about the Moderna recommendation. Unanimously recommended by the FDA advisory panel yesterday to move forward with a half dose, meaning the full dose is what you get with the first 2 shots, a half dose 6 months or so afterwards, given to those at higher risk with more serious disease, those over 65, and frontline healthcare workers and emergency workers, et cetera. People are going to have potentially more exposure. So I think that's probably right. It's interesting is the Moderna data looks so much better at 6 months than either Pfizer or J&J. But I think it's important information, and I suspect that we will get that done. I think we're going to wait and see what the CDC says next week. But I really believe, Nate, that they're going to say the same thing as the FDA advisory panel. I'm going to bet.
Yeah, you're probably right. I mean, generally they do that.
Yep.
Not always, but generally. I think it'll be interesting to see what they say today in regards to the J&J vaccine. Do they approve a booster? Do they approve a booster of J&J? Or do they approve a booster of an mRNA vaccine? Or none of the above? And so there's some interesting new data that just was released here in the last 48 hours, I guess, or so, regarding boosting with mRNA vaccine after J&J vaccine, which looks pretty good, looks better.
In fact,
J&J.
it was like if the J&J boost was, you're going to have to help me on the numbers, but the Moderna boost was really high after J&J was like 75 times.
Yep.
Antibody level of Pfizer's boost was like 37 times, and J&J's boost was 4 times. So
yeah. But there is a difference there with the Moderna dose was actually not the half dose.
It was the full dose.
It was the full dose. So that probably explains the
level
difference
of
between Moderna and Pfizer. I think probably at the end of the day, either one of those would be okay. But let's see what they do.
Yeah, I think that's going to be the interesting question. What are you going to say to those 15 million J&J folks? I think they're going to need a booster. I think the other question is going to be, are they going to have 2 shots and then a booster, or just 1 shot and then the booster for J&J? So I think there's a lot of information to be sorted out there. I am very optimistic about the Pfizer vaccination for kids from 5 to 12. Yeah. I think that data looks pretty good, Nate, and my bet is that's going to get authorized next week.
Yeah, I think you're right. I think there's a good chance of that. I wish my 4-year-old was 5, and I think you're right. I think 5 to 11 or through 11 into 12, pretty good.
And I think just to say, we have to treat this pretty seriously. We were on Chief Medical Officer call yesterday, and some of the good folks from Children's Mercy were on, and they have 5 kids on ventilators right now with COVID-19. So, there are children deaths and from this, and we have to take it seriously. And the people who were on the ventilators, the kids who are on ventilators, are all those who are unvaccinated. So I think we've got to step back and just, again, recognize this is not influenza. This is not a mild threat. And the Delta variant is especially serious. And if we're going to take care of each other, we need to be vaccinated. And I think that's a step into the future. And then the stars will perfectly align. And along with November the 18th, which is when the next season of Discovery starts, that'll be a great day too.
Dr. Barr, I get what you're feeling. I do have a 5-year-old, so I understand. I'm so grateful that he'll be able to get it. Dr. Stites, once that's approved, how soon do you think it'll actually be able to get into our kids' arms?
Gosh, I think Nate will know this question better than I do. Actually, I think we're going to speculate probably early to second week in November. What do you think?
That's probably reasonable. I think I'm certain that health systems around the country are preparing as if this is going to happen.
Yeah.
I know there are pediatricians that are, having their doors banged down by parents that are anxious.
And I know we're ready. I know we've had the folks on from Children's. They know they're ready. So yeah, I think we're ready.
Yeah.
Yeah, bring us your arms. We're ready.
I'm just representing all of those anxious parents who have kids that are under the age of 12.
I just wish there were a whole lot of kids getting lined up to get vaccinated.
They are.
I wish a whole lot more adults would get vaccinated. And in our area, I think we're still around 52%, 53% have been vaccinated in the metro. And gosh, we just need a lot higher number than that if we're really going to be safe. And you just hate to say to people, go get the Delta variant so we can all be safe. Well, that's a terrible idea, because all you have to do is get vaccinated and you'll be more safe, and you don't have to worry about all the other long haul effects and all the other problems that you can get when you have the Delta variant. So
you're saying go get the vaccine, don't get COVID?
I think that's
is that this message you've been saying the last 18 months?
What are you doing with your watch? Is your watch
it's something.
broken?
No, I'm just fiddling. I'm fiddling. It keeps banging. I don't. Okay. Okay. Follow-up question, Cody, or other questions on the line?
Sure. Yeah, just one more. As we talk about boosters, and with the especially low, I think it's safe to say vaccine uptake in our area, and and numbers not being where you want them to be. Do these booster shots, does that help with wasted doses and making the most of the doses that you have on hand?
Yeah, I think it does, and I think that's a good comment, because we get to reconstitute the dose, so we can reconstitute a half dose nade or a full dose. So I think it's going to help us with that, and then we ought to make sure we get the whole darn world vaccinated.
Yep. Yeah, I think that's the biggest point in all of this is wasting doses is incredibly sad, because there are many people around the world that desperately would love to have a dose and just haven't gotten access to it. So it's pretty heartbreaking to be wasting doses.
Other questions? No. Okay, so we're going to get to our community questions, and we'll get to some follow-up questions as well. As we mentioned, this week is National Emergency Department Nurses Appreciation Week, and we certainly do appreciate them. The latest data from the CDC says that more than 130 million people visited the ER nationwide back in 2018, and of those, 35 million were there to be treated for some sort of major injury. Now, you add on a global pandemic, and you can imagine the massive strain that it has put on the department and those healthcare workers who are there working on the front lines of this pandemic, from long wait times for patients to some patients being treated on hallways because there are no rooms available. We're going to talk more about that. So along with Dr. Seitz and me today is Tiffany Clark. She is an emergency department supervising nurse, and we are so glad to have you here with us. How are you?
Good, thank you.
Good. Okay. So if it's possible at all, Tiffany, could you help us sum up what the last 18 months has been like for you and your teams?
So it's definitely been a challenge. So like you mentioned, we still have the traumas and the strokes and the heart attacks and all the other illnesses that bring in people into the emergency room, but you add COVID on top of that, and then you add COVID to the complex patients that we take care of. And so it's been a challenge. It's very crowded, and people are, scared and stressed, and we haven't been able to have the patients have their family support there, and so we've had to take on that as a role as well. And so it's definitely been emotionally and physically challenging. And so working lots of hours and shifts, and also just being that resource for the community. We're the front door, we're the front line, and so people come to us often with their fears about COVID. And so it's definitely been challenging to balance all of that.
Dr. Seitz, I know you'll have questions for Tiffany as well.
I do. So Tiffany, here's a couple of things for you. So first, we know that there were a lot fewer patients coming in with heart attacks and strokes for a while.
Yes.
And that things were going back at home. Are people coming back a little earlier now?
100%. And so that's what we found. So there for a while, people were afraid to come to the emergency room because of COVID. And so they stayed home, and they didn't visit, or they weren't able to visit their primary care doctor. They weren't able to do that, their annual health exams and take care of themselves. And so what that did is it just caused people to become sicker. And so now they're all coming to the emergency room to get help because, primary care is crowded. And so, they're just kind of behind on all that yearly health stuff. And so it is extremely crowded. And so we are getting more heart attacks and more strokes and more traumas and more respiratory distress, and just all of the illnesses that we normally see are just doubled on top of COVID patients. And so we're not able to move people as fast as we would like to in the emergency room. The whole hospital is full, and we're very busy. And so when I mentioned, being as creative as you possibly can, we are having to see patients in recliners and hall beds and every little nook that we can find, because we want to be able to take care of you. We're not going to turn anyone away at the front door of the emergency room. We're going to accept everybody who comes in, and we want to take care of them the best that we can. But space is a challenge.
Yeah, I bet that's right. And the other concern I would have is that with the volumes coming back up like they are, and the hospitals being full, are you worried about what's going to happen this winter when we actually have an influenza outbreak, because masks are off and things like that?
That does worry me because, we are at capacity already, and then you take the flu patients, that's going to increase even more. And so now we have all of our regular patients that come in for all the care that they need. Then we have our COVID patients that come in, and now we have this influx of flu patients that are coming in. And we want to be able to take care of everyone, but it's going to be challenging. There are going to be long waits, and there's not going to be space for you to get in as fast as you would like to get in. And so it is going to cause things, you're going to be a little more uncomfortable in the emergency room. We're
So-
trying the best that we can, but it's gonna overcrowd even more.
So how is the staff down in the emergency room? How's our nursing team doing down there? By the way, I've been here for approximately a very long time, and I've been going to that emergency room with my patients when they come in. I tend to run down and see them, and it is such a different place than it used to be. We have the best team of folks down there, the best team of nurses, the emergency room folks down there. It is a remarkable place, and if you're really sick, it's the place to be. But I think that I worry about our teams because it's been a long year. I remember when we first had the COVID, things were really slow, and everybody's like, "What's going on?" I think the dam's broken, as you've described. So how are the teams trying to handle all that?
It's very challenging, and we're trying to stay as positive as we possibly can. We're trying to be as compassionate as we possibly can, but it can be stressful. We're having to really adjust our care, just with being as creative. We would like to see all of our patients in a room with a closed door, giving them privacy, but now we're having to really challenge ourselves to see patients all over the emergency room when I speak of hall beds and recliners. And so that definitely affects the mood. You kind of feel bad because you want to give every patient that amazing care in a room, and we're not able to do that. It's out of our control because of the volumes of people that are coming in. And so again, the staff, we're doing great. They haven't lost any of their compassion this whole time. And so we're just doing the best that we can, but you can definitely tell there is some days that are harder than others because we're not able to give our patients the experience that we want to, that ideal experience that they would get prior to COVID. So
I think that it's also just important to point out that for a while, it took a while for volumes to come back, but now they've come back, as you've said, and even more. And so I think that's a big deal, and that's one of the reasons our transfer center has had to be so much slower. Is we've had to save hospital beds for the emergency room and for folks what we call a direct admission, and then that means we haven't been able to take as many transfer patients. And I think the way people can help us out there is, first of all, get to your primary care physician, take care of yourself, take your medications like you're supposed to, and also, and this is important, wash your hands, keep your distance, wear masks. I mean, it really does help prevent disease transmission. And during this time where there's still widespread community transmission of COVID-19, it really helps us if you take care of yourself and help yourself.
Tiffany, do we know how our emergency department compares to others in the region? What we're seeing with other teams across the country or even just here locally?
I think that we're probably all kind of feeling the same pressure and feeling the same challenges for sure. But, we are, a level 1 trauma center. And so we are that hospital that we want to accept all the transfers. We see all of this, specialty areas. And so people all over the state and the country utilize KU for their services. And so I think that's a little added pressure for us because, we don't say no. We say, come on, come all, come here, come to us. We're the best. We want to take care of you. And so I think that just adds to the pressure on the emergency room for sure, and the nurses in the emergency room.
I had a question I wanted to ask you because you were just talking about it, but so I want to get to some. We want to get to some community questions today. Is it okay? We're going to ask some. We have a couple that we haven't gotten to this week, so I promised people we would get to some of our follow-up questions. So I'm going to ask about that first. So we say that masks work. Then why do we seem to see a higher number of kids getting COVID?
What?
Well, I would say masks only work if you wear them exactly the right way,
right?
Okay. So if you wear them down under your nose, things like that. Everywhere is different with this sort of thing, right? So some places, aren't getting a lot of enforcement to make sure the masks are worn correctly. So it's variable everywhere. Some schools are really on top of it. Some schools are a little bit more lax on it. So you're gonna see more cases in places where the students, teachers, et cetera, are wearing masks down around their nose.
Are we still seeing higher kids? Because I think what people are thinking is that we're making children wear them.
I know the question. I was probably being a little too sarcastic there. Here's the end. We just have to end the controversy over whether masks work, right? We have to end that controversy. because there is no question that masking works. And we prove it every single day in the hospital. We still have 50 patients in our hospital with COVID-19, right? At one point, we had 300 patients in our hospital with COVID-19. And we didn't see disease transmission on the COVID units of the people taking care of the COVID patients. And the reason is because they wore masks.
Yeah.
Right? I mean, we prove it every day. We prove it in the operating rooms every day. You know, you don't want the surgeons spitting into your wounds. You got a mask on to help them. We wear it in other respiratory diseases. We wear it in the ICUs. We wear it in the emergency room. Masking works. The evidence is incontrovertible. We need to put it to rest. The reason when it doesn't work is because, as Nate has described, people either A, don't wear it correctly, or B, they just really don't wear it at all. And with kids, I think it's just harder. Plus, most kids are not masked, right? Most kids are not masked. And finally, if kids are out playing or getting together and they don't have a mask on, well, they didn't get COVID-19 at school when they wore their mask. They got COVID-19 in the after-school activities, which we proved last fall. We saw that happen across the United States, across the world. And so there just is no question that masking works. Is masking fun? No, masking is not fun. Do I like to wear a mask? No, I don't want to wear a mask. But I do that to stay safe and keep other people around me safe. I see it as an act of love. And I think that to me is what really masking is about. But does masking work?
It works.
Nate, help me.
It works. I mean,
Yeah.
it works. It just does. Is it 100% effective, period? No, it's not. But nobody's ever said that, right?
But it's dang near effective.
But it's
I'm
very
gonna bet
good.
You guys feel pretty comfortable wearing those masks down the
Very
ER,
comfortable.
Tiffany.
Yeah. Absolutely.
Yeah, and don't you get nervous when people don't have masks on? I mean,
I
see
do.
It just bugs me. People down
Yeah.
there, they have it below their nose. I just want to reach in and say, just put your mask above your nose. When Hawkeye and I went to the freezer last year, we took our masks below our nose. Guess what? Big old breath cloud all around us, right?
Yeah. Yep.
I have news for you, though. I think you're going to have to probably repeat exactly what you said about 10 more times before this is all over. So
I probably
you
will.
You know
10
it.
to a log of 5.
That's why we have you to
I know.
continue to
So I
say.
keep saying the same thing. And
But-
usually I'm not frustrated, but yeah, for some reason today I was
Just
just a little
today,
frustrated.
it's okay.
I'll be
It'll be a
fine.
little-
It'll be good. It'll be good.
It's all right.
I'll be
That's all
back.
right. You can do
Yeah,
it.
yeah.
Okay.
LLP.
So you did bring up something. So a couple of questions. Todd and Kiki had questions. That one was, what happens if a patient does refuse to wear a mask when they come into the ER, and how do you know if they're vaccinated? I'm assuming you don't when people walk through those doors. So how do you handle that?
So we don't know if someone's vaccinated when they walk in the door. During the triage process, we do ask, and that's the time that we also suggest. We ask them if they would like to get a vaccination, because we want to make that happen if we could, because that's one opportunity to get it done. As far as not wearing a mask, it is mandatory that you wear a mask, and of course you're going to have patients or people who come in the door that, for whatever reason, have the belief that they don't need the mask. And so we just try to do our best to explain to them, this is like our armor. This is our way to protect you and to protect others. It's our job to protect you. And so therefore, it is mandatory that you wear a mask. Again, you always have those people that are going to be a little more adamant about not wearing the mask.
You get the pushback, I'm sure.
We absolutely get the pushback, but, we also have to push back and say, no, this is what we have to do to protect you and your family and protect us. And so this is something that we just have to do. So
Isaac has a question for you. What is your opinion behind using vaccination status as a triage criteria for prioritizing patients? Many people think this is unethical, but many feel like this is something that people should do. Just what are your thoughts when that topic comes up?
So the question is, how do we feel prioritizing people who have been vaccinated or
Yeah,
not
just I
vaccinated?
think socially people talk about that.
Yeah,
if
if you
you're
have two
vaccinated,
people- yeah.
you should get priority
If two patients
treatment.
both have a heart attack, they look about the same level of illness. Do you take care of the vaccinated person before the unvaccinated person?
So we take care of all of our patients exactly the same.
Exactly.
And regardless of your vaccination status, obviously we want you to be vaccinated because, again, our job is to keep you safe, your family safe, the community safe. But we're taking care of you the exact same way. We care about you just the same. And
It's
so
a dangerous slope, right? You can't can't say that, 'cause so we're not going to take care of the smokers first. We're not going to take care of the
Right.
people who have diabetes first. We're not going to take care of the person who has blonde hair first. I mean, pretty soon you get to this really slippery slope in which you're trying to rank order that, and you just can't do that. So I think we will not be in it. We're not going to be in a position where we're going to use vaccination status to triage patients
Thank you.
like that.
Clearing that up. Sandy wants to know, Dr. Barr, jump in on this. Should I get my flu shot and prep for those masks coming off?
Yeah. I already got mine. Go for it. Yeah.
We're going to get ours on the program as soon as Hawkeye lets me. He says, I want us to get it at the end of October. I'm like, okay, sooner, better, and later. I'm ready to go. Give me my... He's just building up his biceps again to embarrass me. That's what he's doing. I know what he's trying.
Paula has a message for you, Tiffany. Just thank you to all of the health system frontline workers for all that you do. So a lot of comments coming in from our viewers about just you're doing God's work, I think one person said. So Matt wants to know, when people come to the ER, are there people who are fluent in sign language, or if someone comes in and doesn't needs quick help and they don't speak our language, do you have somebody to help with that?
100%. We have several different methods to interpreter methods. So we have people who are actually on campus who can come down in person and be Spanish interpreters. We also have interpreter iPads and a phone line where we are able to communicate with almost every language there is, including sign language.
Linda's asking, so if I get the booster, how long will I be protected after that? When do I need another shot after the booster?
Yeah, we're not going to know that one for a while, Nate. I think that's a hard one because I'm going to bet it's at least 6 months. I think, but that's just a bet and a little bit of speculation on my part.
I mean, I think the hope is that there's very long-lasting immunity after this, but we don't know that yet. I think the hope, though, is, perhaps it's a very long time, but we don't know. We're waiting on more info.
And it also depends on whether there's a variant that comes about. And do you think we're ever going to pivot with the messenger RNA vaccines to get a little bit more of the Delta variant into those vaccines?
Yeah, I think we should. That makes sense to me.
Yeah.
They have the ability to do so. Early when some of the Alpha variant and things were coming, they were doing some adjustments with that sort of thing. So my hope is that that's what happens.
I thought I saw that Moderna Pfizer one was doing a study about it and looking at some Delta variant pivot that they hope to have the data around the first of the year. Does that ring true to you?
It vaguely rings a bell.
Yeah, okay. That means I may be making it up, but I think that's right.
Tracy says, I currently have a breakthrough case of COVID. I'm also eligible for the booster. Should I get that now or just rely on my natural immunity for the time being?
I would still get it. Obviously you want to get past this acute infection, but I would still get it for that very reason I talked about earlier. If new variants come about that are of concern, vaccination is going to provide you better adaptation. Now, you've already had your initial vaccination, so you'll have some of that. But we're talking about sort of boosting these antibody levels for a time, and that can provide you additional protection.
Follow-up question from the week: should we be concerned about the new C12 COVID variant?
Yeah, I don't know a lot about that, Nate. You probably know more about it than I do about the C12 variant. So
I think with any variant that comes out, I mean. My sort of way I think about it is be a bit concerned, but don't sort of lose sleep over it, right? I mean, we don't know how all these variants are going to balance each other. We were very worried about, for instance, the Beta variant and
the Lambda variant, the Mu variant.
Yeah.
And they got outcompeted by the Delta variant.
Yeah, they all got outcompeted by Delta. And so we don't know whether this new variant is going to be able to compete with Delta or not. And so, what we can do is we can watch our numbers and see what the health departments of the various states and countries are seeing. And we'll adjust as we have to, but for now I would say Delta's plenty to worry about, and it doesn't change anything in terms of the things we need to do to be protecting ourselves and our community. Yeah,
the thing I saw with the C12 thing is that all of this is very early information so far on it, and I don't think we really know how it's going to compete against the Delta variant, and only time will tell us that. So unfortunately, we can look at all the genetic material inside that virus, but until we see how it acts clinically in our bodies and in the public and how it transmits, et cetera, we really don't know enough. We can't. All the predictive models aren't as good as real world data.
Yep.
Tiffany, Glenn wants to know, do you ever have a slow day? Or maybe what is a typical day right now?
So we'll have slow moments. I wouldn't say we have slow days. It's kind of a roller coaster. We'll have people, some hours of the day, we'll have 25 people check in all at once. So a typical day right now is sometimes we'll come in the mornings. I work a day shift, and we'll have what we call bed holds. So several patients waiting in the emergency room who have been admitted, who are trying to wait for rooms upstairs, but because we are very crowded right now, it's kind of hard. And so we will often come in the mornings. There'll be 12 people in the waiting room waiting to be seen from overnight. And so there's not as many people coming in the mornings, but then, we kind of get backed up. And as it gets closer to 11 or 12, it starts to pick up a little bit more. And so it's kind of hard to say, do we have slow days? We don't really, but we do have slower moments. But then we're busier in other ways. Like I said, we'll have people left over from the night shift, or people who are waiting in the emergency room to go upstairs because they're admitted. And so it's kind of always busy in the emergency room.
And there's a flow to your day, though, right? There's this kind of timing. So if you really have to come to the emergency room, what time of the day do you want to come with the shortest wait?
I'd probably say earlier in the morning would probably be the best time to come.
5 a.m., yeah.
Right. Sometimes between 5 a.m. Before lunch would be a good time to come in. But again, it can be busy during those times as well. So you could still have a wait time just because we're trying to get people who are admitted upstairs. But that is generally a better time to come.
And when's rush hour?
Usually after lunch.
Yeah, till about midnight or 1 or 2 in the morning.
Mm-hmm.
It gets getting pretty good. I
Correct.
think the evening shift is like,
Yeah.
holy cow.
Yeah, that 10 to 10 is a tough time for sure.
So that brings me to a question I have. We know we talk about nursing shortages all over. Is it especially difficult to recruit nurses to come to work in the emergency department?
I think that it can be challenging sometimes just because of, the emergency department already deals with a lot of complicated and complex patients, and there's a lot of adrenaline involved and a lot of excitement. And so I don't think it's hard to recruit people to come to the emergency room because, it's pretty exciting work. But, sometimes it takes a little extra care to keep those people in the emergency room once they get there and see, how challenging it can be sometimes.
Do you have to be an adrenaline junkie?
I think you do have to be a little bit of an adrenaline junkie for sure. You definitely have to be very flexible. And I always use the word creative because, we just have to be extremely creative.
Do you have to be, do you have to be a little bit crazy?
Yeah, little.
And you know what that
I would
old
say
song?
crazy.
That
I
old
would
song.
say
I know, it's always been crazy. It keeps me from going insane. There you go.
Sally has a son who actually is interested in becoming a nurse. Do you see a lot of, I know we have a lot of fantastic male nurses down there, but do you work with a lot of men?
We do. I mean, not as many, of course, but we do have several male nurses that we work with. And so, yeah, it's a very good environment for both. It's great.
Leanne has a question. I heard variants are named alphabetically the same way hurricanes are. Is that true?
Well, mostly we've been doing that, I guess, so far, but this variant thing has been a bit of a,
There's a lot
the
of
names have
variants. We've been
changed.
kind of running through the alphabet and coming back again.
Right?
Yeah.
Yeah.
Ashley wants to know that a good masking question for you.
All right, here we go.
Ashley,
they do work. Masks
Ashley's
still work. In the last 10 minutes, there's no new evidence that
nothing
says
new
that
does. But
masks don't work.
Ashley is a
So-
good friend of the show, and she watches daily. She says, she's just asking for a little hope here. Do the doctors see a day in the future when we will not all be walking around with masks on?
I absolutely do. And I
Okay.
think the day is when people have been fully vaccinated and we get the public vaccinated and we see the COVID virus. COVID will not be forever. Not like we know it today. Now, I think SARS-CoV-2 as a virus will be out there for a very long time. But if we get people vaccinated and we practice safe techniques, I don't think we're going to have to wear masks all the time. And I certainly hope not. As I think I told you guys when I was out in Colorado a couple of weeks ago, I was outside the whole time. And it was like went for almost a week without wearing a mask. And I was like, this feels so great. And then went to the airport, like, put the mask back on. And but I think that that's where we all want to be. That's where we all aspire to be, and we can get there, and we can do it safely. So I don't think that we're going to be in masks forever. But I think it's going to take a while because we've got to keep working on our 84 million Americans who have decided not to get vaccinated because they hold the key to keep getting us all unmasked.
We have to have 84 million more shows.
Oh, good Lord.
So hunker down, my friend.
Yeah, let's see it.
One person at a time.
Yeah.
Okay, so Billy says, I currently have Bell's palsy, believed to have been caused by the shingles virus. I don't know about that, but I'm 6 months in and about 65% recovered. Is it safe for me to get my COVID vaccine now? I'm just worried about losing the progress that I've gained.
Yeah, I would do it, absolutely. Yeah, shingles virus, that's definitely one that can cause Bell's palsy. Obviously, I don't know your situation, but it certainly can. But it's all about weighing concerns, right? And so the concern I'm guessing that you have is that the rare possibility that the vaccine could cause a Bell's palsy or make this worse somehow, extremely rare, and you're much more at risk for getting sick from COVID. So I would get COVID right away, or COVID vaccine right away.
No, that's no.
I have not changed tracks, I promise. I would get the COVID vaccine right away, and I would feel confident about it that you're protecting yourself from the much bigger threat.
We had some pretty cool people on this week, just to say that Bell's palsy thing, who are talking about facial nerve reinnervation. That's pretty cool stuff. I think, not that we want you to have that, but just to say there are some cool things coming for Bell's palsy. But the real problem will be, I think if you wait on vaccination and get COVID-19, the likelihood that you may worsen your Bell's palsy is real.
Yeah. I mean, this is the case with a lot of these extremely rare vaccine issues, right? They're in every single one of them, much more common with COVID. So, we talk about this with myocarditis and things like that. Your risk is way higher if you get COVID from having that issue than it is from the vaccine. So it's all about weighing this stuff, and it's really clear. The COVID vaccine is definitely the way to go with that sort of risk.
Marla received both vaccinations, a breakthrough COVID illness, and antibody infusions. How long should she wait to get the booster?
Yeah, that's a great question. We need to probably know more about her story overall, but I think I would treat the booster kind of what we did with the Pfizer thing, which is, probably 3 to 6 months after your infection, you might get it. I think that has been a recommendation around the Pfizer one. That probably holds true. I think if you're in a really high risk category and you're on a lot of immunosuppressant drugs, or you've had an organ transplant, or you're getting chemotherapy, I'm not sure I would wait very long at all.
Yeah, that's fair. The overall recommendation is still 3 months to wait after monoclonal therapy for that, but it's that's really based on just the half-life, how long it takes for that drug to decay. So you're absolutely right, that's not going to be appropriate in every case.
A couple more questions here. Ruth, how do you define breakthrough COVID illness?
Oh, that's messy, because the problem is that it makes it sound like a vaccine failure. It's really not a vaccine failure. And people say, oh, you're just trying to be nice about vaccination. No, we're not. Yeah. We always knew that even if you've been vaccinated, you could still get COVID-19. It's just that your rate of getting it was so much less, and the rate of death is it's like reduced by 99%, literally, from those who have not been vaccinated. But and technically, I think, Nate, you're, again, probably better positioned than I am, but a breakthrough infection is, do you get COVID-19 after you've been vaccinated?
Yeah, I mean, that's the broad definition, but you're absolutely right. I mean, the most important thing to remember is that the phrasing sort of makes it seem as though the vaccine failed me somehow, and that's just not the way this stuff is. And it's probably, it's an issue we probably broadly need to think of a little differently. Before COVID, we weren't all so into vaccines and this nitty-gritty data about, when you get the vaccine, can you still get it, all this stuff. These vaccines are still performing extremely well when it comes to preventing infections and, most importantly, preventing hospitalizations, preventing deaths. We continue to see that day after day with our patients locally and with the national numbers. Very clear. If you are vaccinated, you're much less likely to die from COVID. You're much less likely to hospitalize from COVID. And it's really a sad thing to see so many unvaccinated people so sick in the hospital day to day.
Can we just say that the problem with this is there's a nuance to this whole question.
Yeah.
If you look at the average age of those who've been vaccinated that come into the hospital with COVID-19, it's 67. If you look at the average age of those who are unvaccinated that come into the hospital, it's 52. And remember, children says a lot of kids. If we did that, our numbers would even be lower for those who are unvaccinated. We'd probably be in the low 40s or high 30s. So the reality is that what's happening is if you get vaccinated, you come to the hospital, you probably have other underlying diseases. Like you had an organ transplant, you've had leukemia, you're on chemotherapy, you have multiple diseases that has put you into an immunosuppressed state, like somebody's obese and diabetic. So you put those things together, that's why vaccines in some subpopulations don't work as well as it does in the overall general population. And what we're learning is there are some populations, just like we've learned about organ transplant, where you probably need 3 vaccinations, not 2. So now our standard is if you get Moderna or Pfizer, it's generally what we give for organ transplants. A month later, you get your follow-up shot, and a month after you get another shot. We now are giving a series of 3 shots, not 2 shots, to make sure you're fully immunized. And then you're still going to need a booster. So the more we learn, the more we learn.
Okay, couple more questions. Help Brian out with this one, Dr. Stites.
Okay, Brian, I'm coming for you.
Okay, it has to do with masks, but he needs you to help him be better armed to answer these questions.
Okay.
Because the question comes up about, he goes, can we please put the argument that masks are nothing but a petri dish when it comes to kids getting COVID? That when you put the mask on, it gets dirty. That's why more kids are getting COVID, because the mask is that. He says he keeps hearing this as being logical. He does not feel it's logical.
It is not logical
But he wants
at
your
all.
help.
It's not logical at all. Because, again, ask yourself when you step outside on a cold day to take a deep breath and blow out. And watch where your breath goes. Like, we call that the breath cloud. Now, put a mask on and do the same thing and see where your breath cloud goes. Some people will say, well, but the virus, the bugs are all sitting in the mask, and if they touch the mask, then they'll get it. Well, no, wait a minute, stop. You're breathing out into the mask. The bugs are already in you, right? They're already there. So if you touch the mask, that's who cares? You've already got them in you. You've been breathing them into the mask. The point of the mask is to, again, think of the breath cloud, stop your breath from going out and getting into others. As a secondary effect, masking does help prevent you from breathing stuff in. But you say, well, you're just going to breathe in that stuff that's in a petri dish. No. The stuff on your mask is the stuff that's already in you that you've already breathed out. Breathing it back in is not going to hurt you. It's already in you. So don't think of a mask as a petri dish. Nate.
And it's not why kids' cases are going up.
No, it's not why kids' cases are going up. Kids are going up because because the Delta variant is highly transmissible, and kids are back together. They're in schools together, and they're doing after-school stuff together, and they're right around each other. That's why the numbers are going up.
Yeah. And I just add, if you're worried about a petri dish from the other way, right? So what if people are breathing on you? I've heard that one too. That makes no sense to me either. And the reason is, what would you rather have? Something in the way of all that stuff coming in, or it having a way to go right into your face, right?
Okay.
That's how you get it.
The weather's getting colder. Go outside. Try the experiment yourself. Watch your breath cloud, then put a mask on and watch your breath cloud. Proof is incontrovertible. And again, I just come back to the hospital. Every day, we have people wear masks. And every day, we don't see transmission of disease in the hospital. It is incontrovertible proof. There is no greater hotspot in any place in the United States than a hospital. And we don't spread COVID-19 in the hospital. Yeah. Ask yourself, why? When people want to give you all these other silly explanations, why don't we just look at the obvious one? Masks work. And we prove it every day in the hospital. Just point that out to somebody. There's not COVID disease transmission in the hospital, in a pediatric hospital or in an adult hospital. Why is that? Because people are masked.
And I appreciate Brian's comment, because I think that's why people watch this show, is because they're faced with being out there. They're not physicians. They're not medical people. And they're faced with these sometimes illogical and absurd and they want to be able to intelligently be able to explain it, and it really helps them.
They're coming from the made-up news network, the MUNs. Don't listen to the MUNs.
So it helps them to have better conversations with people.
Yeah, we appreciate that, right? I mean, this is the whole reason we're doing these sort of things, is to try to get good information out there. So we love it when people are taking that information and using it to talk to their neighbors, because, you know, we're just trying to spread truth. We're trying to overcome some of this misinformation, and you know, it's really helpful when people take that upon themselves to talk to people they care about.
That's exactly right. Just remember, bars versus restaurants versus hospitals. Where is disease transmission taking place? not inside the hospitals.
Okay, I have Brooke has a random question for you, Tiffany, and I love it because I'm actually on my cell phone asking you this. She says, do you treat people who get injured from texting and walking? I know texting and driving. We hear about that. Do you ever have just some person who does some ding-a-ling thing and is on their phone, not paying attention, and comes in and says, I was on my phone and I did something and now I'm here?
Absolutely. Of course.
Really?
Absolutely. Yes. We all know that texting is extremely dangerous.
Texting trauma.
Yes.
Texting trauma.
It's
And not just texting
like
and driving, not just texting and driving?
100%. And my favorite new thing is the scooters texting and riding a bird downtown. So that's always an interesting one.
Yeah.
Maybe tell me this. Did they have a mask on when they were doing that?
Good question.
Probably not.
Probably not.
Probably
Yeah.
not.
I think
Good question.
texting and masking might go,
Texting and scooting. There you
Yep.
go.
texting and scooting. Were you going to say
Yes.
something? Did you have something to say?
No, I was just laughing.
Okay.
I was gonna call it texting trauma, TT.
TT. Okay, we're going to get to some final thoughts. Got a little something for you.
boy.
Tiffany, just your final thoughts as we head into the weekend.
So final thoughts is that the emergency room is extremely busy. Obviously our doors are open. We want to take care of you the best that we can, but just know that it may take a little bit longer. We will take care of you. We'll give you the same care that we would give anyone, whether you're vaccinated or not vaccinated. But things might just take a little bit longer these days. And just do your part if you could. We beg you, please, if you are able, get your vaccination, wear the mask, wash your hands, social distance when it's appropriate. And I think all those tools will definitely help you and help us in the emergency room as well.
Please pass on to your team that the folks here watching today are sending the love, and we really appreciate you.
I will. Thank you so much.
just
We really
We
appreciate
do
that.
really appreciate them. They're the best.
The best.
Love our
Thank
nursing
you.
staff.
Nathan Barr, so nice to see you on a Friday. Thank you for
Yeah.
being here. Good to have you.
Happy to be here.
Final thoughts from you.
I don't know how to follow that up. That was pretty perfect, but I guess I'll reiterate some of these points because, it's not only that initial ER visit, but it's everything that can come after that. So it's it's being sick in the hospital, it's potentially dying, it's the sometimes really difficult long road that can follow COVID, even if you didn't end up in the hospital. I know of plenty of cases of folks that were really world-class athletes that can barely walk across the room 6+ months after COVID. That's something we all want to avoid. Best way to avoid that is to get vaccinated, to wear your mask, to keep distance from folks, do all those things to protect yourself and also, just as importantly, to protect the ones you love and your community.
Thanks, Dr. Barr. Dr. Stites, your final thoughts.
I am so thoughtful for the great folks that we get to work with, people like you, the folks in our studio, Nate, Tiffany, and all our nursing staff, male and female, because it is the best profession, and these people do great work every day, and they're tried to be here to help everyone. And what we really would like, if there's one message you take from this program, it's that we should all help ourselves and help each other, and quit fighting with the silly stuff, and let's just get back to looking up and seeing what we can be instead of fighting about the silly stuff.
All right. Speaking of looking up, was that not a great segue, guys? All right. Let her roll. So they pulled up this is Shatner, it's your boy, up in space.
No, live long and prosper.
Right?
Don't we all want to get to be 90 years old and do something like that and be in good enough shape to do something so cool that's totally on our bucket list? I'd want to go. I'm ready to go. Let's go.
Would you go to space for real? I've always think if somebody said you could go.
Are you kidding me?
And no guarantee that you're going to make it back
Live long and
alive.
prosper. Live
Would
long
you
and
go, Barr?
prosper.
Come on. I don't know if you would.
Sign me up for Starfleet. I'm ready to join right now.
Would you and I could watch?
When my kids were older, I would go.
Okay.
My kids are older. I'm ready. Dr. McCoy, let's go.
So if you're going to be taken out by the space program, that's the way to go, right?
Yeah.
That'd be the way to go.
Starfleet, sign me up.
All right. I love that. Okay, everyone, thank you so much for being with us today. On Monday, we bring on Poison Control. Its call center is housed right here at the University of Kansas Health System. How it works and why it's necessary for everyone to have its number programmed into your phone. And don't forget, you can always watch our shows anytime on Facebook and YouTube. So we're going to see you back here on Monday, 8 o'clock. Have a great weekend.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.